to change this.
So we have to get a sterile draping.
Yeah, definitely. Go get a sterile drape out of the
And sterile
equipment
gloves,
room.
please. And your
Oh, these are small. I can't fit those.
How long are the suture ties normally kept in place before?
Say that again?
How long are the suture ties normally in place when they do a new trach?
How long is
The
The
suture.
suture ties?
the sutures? Is kind of up to the surgeon and how fast it's healing. One thing that I want to caution you is if it's a new trach. I don't know about how you guys do at Jersey Shore, but at Monmouth, if let's say this person was just trached, say, emergency trach last night, and you come in the morning and there's all blood here, the first thing the nurse is going to say to you is, "Can you change the trach ties?" And my answer is no. Because if this is less than 24 hours old, I'm not touching it.
The doctor has to, right? Doesn't the
Right.
doctor do the first
The
change?
initial, right. I am not, even though I said to you, you never let go of this thing under any circumstances, if it's a brand new trach, I'm not even taking that chance.
Right.
Because remember, if it's brand new and this inadvertently comes out, that hole is going to close up right away. And they're going to have to call the surgeon stat.
Do they still change that frequently? With like a brand new?
We
Like-
usually give it at least, like you said, until after the doctor has come and said it's okay to start changing the ties now.
Okay.
Then every time you do trach care, you'll change the ties. And sometimes if it starts to get all gunked up and mucousy, you can come in and change, because you might change the gauze and the ties because they're
So
bleeding.
you're still doing that part. You're not just changing the actual. You're not going to be changing the ties on it.
Oh yeah, you can do
You
regular
you
trach care
you're
without
gonna do
changing
trach
the
care
ties.
and change down here if need be, but you're not going to go and change that.
Not touching it.
So initially then, there'll be a doctor's order for us to start changing it.
Usually, yeah, they can just say trach care, PRN, or trach care
Okay.
according to protocol, and then you can do it whenever
Okay.
you feel like it. Like, you don't have to do it every 8 hours. If you think it needs to be done in 4 hours, then you can do it in 4 hours. You can change these ties. You don't have to wait until you do trach care to change the ties. If the ties gets all gunked up and bloody and mucousy and you think you need to change it, change the ties. You don't have to wait until you do trach care. Okay, so when you're going to do trach change, you will need your whole kit like it's laid out here. Just the right side. And you will need sterile gloves, you will need your suctioning equipment, you will need the obturator. The obturator is kind of like the stylet on an ET tube. The purpose of the obturator is to give you a nice smooth surface so that you're not doing what they call plowing when you're pushing the tissue. If you put it in like this, you can actually get mucus in the actual hole, or you can do like snow plowing of the tissue. So you're going to put in an obturator and you're going to hold it with your thumb, and you see it gives you that nice rounded edge, so it's easier to to put a new one in. And like I said, this is your patient who is in that long-term care facilities who's had this trach in for like weeks or even months.
It clicked in, Mary?
No, it doesn't.
Obturator.
You literally have to hold it in.
Okay.
And this person will almost invariably be on a trach collar or some other kind of device because they're no longer in critical care. So you suction after you assess, have all of your equipment ready to go. Could I have another trach tie, please?
So you're still getting the same kit. You get the same exact kit. Or
You're,
you just get a
you're
sterile
not
dressing?
you're not doing trach care now. You're going to open up this box.
Right,
and
and
it's
you
going
just
to have
have a sterile
everything in it you
dressing.
need.
And then have a sterile.
Have your sterile towel, your sterile field set up. Suction your patient.
What's in that for?
Attach your
Just that.
attach your gauze. I mean your this thingy. And this would have come out of a sterile package, so it would still be clean. You might want to lube it, put a little surgeon lube on here. Instruct your patient so that they know exactly what you're getting ready to do. They've been hyperoxygenated and suctioned and then oxygenated again. Take this off. Deflate your cuff.
Just continue.
Oh, okay. Did you see it? Okay. Make sure that your cup is deflated. You never want to pull one of these things out, just like with an ET tube if the cup is deflated. Okay. This is ready to go. It's surged. Your cup is deflated. I'm holding the obturator with my thumb. Okay.
Mary, you're using your dirty hand though, aren't you? Because your right is your sterile hand.
Actually, when I put my sterile glove, I would disconnect everything, but I'm going to have to because I don't want to let go of this one until I'm ready to pull it out, but I also want to have this one ready to go in. But I was always going to have a glove. Did you put sterile gloves on to do this? I didn't. Okay.
And do you check that cup before you put it in?
Mm-hmm.
Okay.
Just like with a ET tube. So I'm going to take this one out and immediately put this one in. Immediately take this out because otherwise the patient can't breathe.
Does it really come out easily though?
What?
It does?
The
When
tray?
you're actually changing the actual trach?
Yeah.
Yeah.
Oh, you've seen it done?
The cup first.
When it's when the doctor did, that's why I'm saying I'm learning everything else when the doctor did it. All he did was put gloves on, he asked me to get the lube, I went and got his lube, came back, he opened up the package just like this, went over like this, glove, took it out and put the other one in.
Yeah, it goes just that fast.
Do we inflate the cup before we tie it around?
If he's on a ventilator, yes. If he's not on the ventilator, it doesn't matter.
I'll just do that.
Okay.
I would want to tie it before I do anything else. I would want to make sure it's secure.
Okay.
When you inflate the cup
If he's
on
not
that,
getting
is it kind of like an
pressure
LMA where there's
ventilation,
going to be some
It's
movement?
just on the
Say that again?
When you inflate the cup on the trach, is it like an LMA where there's going to be a little bit
No.
of
That's what she said, if
No.
you want to inflate it,
No.
if you're not, you don't have to.
There shouldn't be any.
when you
And-
inflate it unless they were on a vent.
No, there shouldn't be any movement when you.
If this patient was on a vent though.
Then you wouldn't inflate it.
If the patient was on a vent, you would still want to secure it. I mean, you've only got two hands.
Well, no, that's what I'm
Unless
saying,
you
like,
have
if
a
no one's on
second
a vent, wouldn't it make sense to have somebody else with you?
If this
so that
patient
you
was
can-
on a vent, you probably
Well, if you
wouldn't be
don't-
changing it. The doctor would be.
Right, okay.
And then you would be the second person that would be reinflating the cuff
Okay,
right
no, I'm
away.
just thinking like, you have to be so quick and that takes.
Yeah, that's why I
couple
said this
extra
is usually
seconds.
your person that's going to be in that extended care facility who's had a trach in for like weeks, so the hold is probably permanent.
And also, if they're not on a ventilator, they won't have a cup.
Yeah, you don't cuff it.
Yeah, so most of them won't have a cuff unless it's a Bavona or something like that. Speaking of Bavonas, these are Bavonas.
Oh.
Now, I got this one actually doesn't work because students play with it and broke it. Is there a syringe around somewhere?
It's huge.
How would that
That's the foam, right? That's the
Mhm.
foam thing.
This is the foam, because now remember with your regular tracheostomies, just like with your ET tubes, you have the cuff that you can blow up. Okay, and like Caitlin said, you're going to always check the cuff before you insert the old one, and then you're going to blow it up. The Bavola kind of works just the opposite. When you get ready to insert the Bavona, you have to deflate, take all the air out. You're going to surge it up, you're going to insert it, and then when you take the syringe off, it blows up all by itself.
Oh.
This is a soft foam cuff. It doesn't exert the same kind of pressure on the trachea that your normal cuffs will. So this is for